I recently learned this in Bali, which I believe many people experience that, but nobody really talks about it. This heart-pounding experience isn't in a boardroom or in front of investors, but on a ATV ride.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
What was one of the most thrilling experiences that you had? You know, the moment where your heart is pounding, your palms are sweating, but you're still gonna wanna do it? Did it come when you last pitch your business to investors or present to your board members, or just simply having fun, trying to jump off a cliff, skydiving, or anything that you like to do? Now, I had that moment in Bali on this vacation doing a ATV ride. Now, I don't even ride on that bike, but let me tell you, it was tough. It taught me a lesson, an unexpected one, about business creation. Doesn't matter if you're early stage or you're in that growth stage. What we all have to come down to is a clear path, that strategy, no matter what happens, you're gonna keep going, and the right people and resources that you need with whatever you got to be able to move forward. So there I was, all suited up in the middle of the jungle. Clearly, you only have gears of a vest in case you fall into the water, and you are wearing boots. They don't even give you socks. You're wearing these plastic baggies as socks in the muddiness, and with a helmet on. And then you get going. The basic 2-minute instruction on what's brake, left backhand, front brake on the right hand, and which is very important when we're going down such a deep, steep trail. And how do you pedal at gas when you needed to go upwards? And I'm in a vehicle by myself. Now, in the beginning, they have you go to a basic trail of water and mud run just to get you used to it. So I thought, of course, I've been driving vehicles since I was 16, back in the day that my family actually owned a driving school. One of the earlier experiences of entrepreneurship that I had is selling about those plans, but also the advantage of I was able to have a car earlier on in front of my friends when everybody else is still trying to get their vehicle and get their driver's permit. Now, digressed. I thought, of course, we all have transferable skill sets. In healthcare business, when we are clinicians, gone through schools for many, many years, and the process that we learn is to ask the right question and get to the right answer so we can use our logic to either test it out with diagnostics. In business, that means you have some kind of set system and framework that you can test out your hypotheses, and then putting the treatment behind means execute on the plan. And sometimes people do get caught with the execution part of doing more and more and start getting lost track on the path that you have created because there are so many distractions. Now, on this course, there are technically no distractions. You are your own distraction, or everything can be a distraction. There are the rivers, there's the trees, there are pretty birds. What are you actually paying attention to? Are the entire environment, and maybe that is the goal. When you are on a path forward, maybe it's about enjoying the journey as you perceive it, or you are someone who's goal-oriented. So you are always about getting to that next destination. Now, when you are on this course of ATV, it's muddy. You just have to go for it. Now, there are controlled ways. When we're going up the hill, and especially there's some ramps where I have to just accelerate and do a quick turn. And I was hoping I'm not going to flip this vehicle. And sometimes when you're going down the hill super steady, I hope I'm not flipping myself over the other way, but I'm clenching on the double brake. There's actually very easy to go forward because there's no going back. There's nothing to turn back around. There's just that one single track. So despite the nervousness any of us have in business, we all get to that point. However, if you only have one path forward, it's laid out for you, it's documented step by step, you know the KPIs, you understand what you have to do, what your team have to do, who's helping you, at what point you have to pick up the slack, and who's doing quality control, and then who's doing the final checkup and review. Then you don't have to question anymore. Then you can actually hit the acceleration instead of constant brake. So halfway out of the track, my hands start getting cranked and my neck start to tense up because think about it, when you're going down a step hill, right? And your whole body is tense holding the brake. Now we all felt that way at some point of our career, of our business development journey. That tenseness, that nervousness, for some people, it's a push, it's a drive to say, okay, I'm doing something good, means it scares me, but it actually feels right. Versus for other people, that scarcity, that nervousness is what truly holds them back, despite that they have a clear path. And it's even more scary for many people who are in the mindset of, I'll just jump off the plane and build a parachute as we go down. It's crazy thinking. It's old school thinking. It's not sustainable. You can only do that so much for so long. Means you can bootstrap yourself. You have some investments coming in, but if you do not calculate to have enough runway and you're not actually bringing results back, guess what? What we always hear is you need a more client and patient onboarder, then come back to us, right? We say that to our clients all the time as well. And sometimes, unfortunately, we see the potential, but they're just not quite there yet. And when you hear oh yeah, we have this supposedly contract in conversation, they had a verbal agreement, we just haven't truly signed it yet, and that will bring us the 3 million patient that we need, and that will give us a projected revenue of 2 million next year. Great. But my next question immediately is, how are you going to do that? Means this supposedly verbal agreement, when are you closing that deal? How are you put on some sweetener to make sure that deal is done? And once it's done, how quickly can you onboard both participants, clients on your platform for your solutions, your services, as well as staff, and train the staff so well that they can retain the patients or the clinicians that you're helping to actually continue to move forward and get to the enough revenue and positive movement that you can have for you to show this is not just a basic proof of concept. Which means a lot of people are in the realm of quote unquote, I know what to do, but how about you don't have so much but? How about you spend some time, actually look into what we always say, 12 different area of critical domain of your business, actually get some clarity. We just ran our Impact Award. So many applicants are not where they need to be. And they say, oh, we don't have the time to even think about those area of our business. You should already know that. It shouldn't take me to force you to look at your business in those way. You should already have those documented, understand it, and knowing the gap, and the strength. And when we put forward an opportunity for you to learn about yourself, and then you make excuses of not doing it, then we also know you're not at where you need to actually be able to grow and scale. And you are just too early stage. You don't even know how to take the right advices. Then that's fine. We are moving on. And that's why for our impact work, there are multiple level of stages of the process. Because at the end of the day, it's about quality than quantity. Here's what the trail has taught me about business success. When facing steep climb, like ambitious business goals, the counterintuitive solution is often right, which is accelerate through the challenges. Those who hesitate often get stuck halfway. Remember when I was saying that there are turns that I have to go up, and it's water, a little river, and then quick turn. Now, I've seen people in front of me who are kind of go slow, steady, very cautious, and then guess what? They get stuck midway. And people have to get out of their vehicle, help them to back up so they can accelerate. Sometimes when you know what you got to do, you just have to push through. But it's not a reckless push through. You are very calculated in the way that you do it because there are people to help you who has demonstrated how to do it right in front of you. You have to trust yourself, your gut, and just keep going. Now, the unreckless way to keep going is because you also have the guidance and the course is right in front of you. And you also know if, just like the people in front of us who couldn't do it so well, if you couldn't get up the ramp, you're falling down, you're falling backwards, you can still course correct and get back on top again. Now, on the trenches of descent, that's also a very scary thing. It's managing those rapid growth or market changes. What that means is controlled execution, especially when you have to descend and you are putting that double brake on. That's controlled. And in business, that also means you know what you're measuring for. You're not just saying, hey, I know how to do it, I'm already doing it. But if you know how to do it, you need to document how things are being done, whether by reporting, so someone else can also do the same thing as you do, so you can duplicate the work and get even more of a result. In early stage, before you hit that 3 million mark, most people has the issue of both positioning the messages for people to understand, and they just keep talking to more and more people, getting excited about things that you believe in, but there's not actually true movements. Because if you don't close that deal, you don't have a business. And if you didn't get that investment, that initial trust still isn't really quite there. And even you do have some investment coming in, family, friends, early VCs, how are you guaranteed that result will be there if you're only a couple men team? You have to be able to know how to hire, where the talent is coming from, how do you pay them, how do you validate and keep track of their performances. So if you didn't document, you didn't create those systems, and you just dive into things, that again can quickly lose trust. And for the people that are not patient enough with you and they're just wanted to see result, yes, we all want to see result. And if you don't have the system put in place to deliver the result, then all the promises are empty. So how do you want to make sure that each time you're meeting with people who are your supporters, your champions, your investors, and potential buyers, they're not just seeing that, oh, you did all these things, but what have you made progress? You didn't just acquire 5 major clients, but then there's no renewal, no retention. What is the actual process you created? So today we're going to talk about some of the major things on why people are continuing to struggle, especially in this new era where we are running away from the grind culture, those are non-sustainable. It's not putting people in a boiling room, putting pressure under, then see who cracks. How about we don't crack? How about we do it in a right way where you can still do what you love, creating the impact, and doesn't feel like you're doing 10,000 things and nothing is moving, or things are moving but not quite in the right direction, or all your advisors are telling you what to do and you're saying yes to them, but actually everything is falling through the cracks. Now, number one thing we're going to talk about today is the 10x is easier than 2x principle, coming from a book by Dan Sullivan and Dr. Benjamin Hardy. It might feel counterintuitive to you. 10 times is easier than 2 times? This is particularly relevant in healthcare business development because this challenges that growth is simpler than seeking incremental improvement. Now, when we're thinking about 2 times, actually just means we are more meticulous. We're just going to double and work harder, right? So how many gurus or business development people out there just to tell you, you got to just do more, right? Just put out more. But we all know you only have certain amount of time in your hand. You only have so many people, staff standing by because you're seeking money, or you're not quite in the revenue place that you are to be able to hire. Or maybe a lot of people do want it to work for you, but again, you don't have the resources to back them up to be able to do more, right? So just because they tell you to work harder, work more, that's really not possible. And even you can squeeze some time in there, let's just say the next 2 months. Do you have the right path, the right strategy, the clear path we talked about that can rinse and repeat and stay on the track and have someone to double check your results and course correct so you can actually generate enough movements for the next round of raise, or for you to generate enough results and revenue to use that money to hire the next set of staff and the right help. And you're not just hiring because you need someone, a body over there. You end up firing that person a few days later. Or the person that you just hired got offended and they left. That's really bad for a company, especially when we look at how much potential you have to actually be something that can be a unicorn. If people are leaving you, if you can't even keep good people, then what are you doing? Today, doesn't matter if the investor or you eventually are looking to sell the company, people are buying a predictable, a proven system that can actually work on its own. What that means is the core concept isn't about working 10 times harder, but you are putting 10 times the effort on the right things. It's about fundamentally reimagining your approach. And in healthcare, that means focusing on a bigger picture than incremental changes. You have to track the incremental changes, but the overall direction you need to go need to be super clear. And building scalable business from day one, and not just, oh, I have this, I'm just going to do it this way. But is that even duplicatable? If you feel like you could not even document it, this is the only way that is easy for you, then you can't showcase to anybody else. The second stage of growth that most people, we mentioned the first break point in early stage companies before you hit that early 2 to 3 million revenue is messaging positioning. You can convert people based on all the conversation you had, social content or interactions, conferences, no matter where you go. And the second breaking point, once you start getting into that 3-5 million into 10 million, it's all about system lacking of role duplication. And it's the critical thing about finding people that can do this job without you have to step in, or your partner to have to constantly step down into those lower level of doing stuff, which means you have to know the vital function, the few things that have the potential to move the needle. So every week Are you looking at the 3 critical vital roles and activities? And every day, are you also doing the same? And then from that micro level, are you matching the clear big path that you're going on your quarterly goals? And how often are you checking your numbers and results to make sure you're doing the right thing before you course correct? And who's helping you in this journey to course correct? Don't rely too many on advisors just having superficial advices who are not actually looking in depth into your company. We call them the title board members, not functional board members. And last but not least, create a framework from day one for your exponential growth. All right, let's move to second point. Now let's talk about the common growth challenges. One of the founders I spoke to recently before the holidays had a solution that specifically helping clinicians to showcase their solution in front of the patients. Now, we all know no matter what you do, how unique you think you are, if you're not getting in front of the right people who are your champions that can open doors for you, relationship, buy from you, or invest in you, then at the end of the day, you are the best kept secret. And that's not helpful. That cannot be any way useful. It's not scalable, then you don't have a business. Now, this AI platform does have potential, and we thought they can be something that we can help to engage. So a simple test, after a round of questions, it come back to be, okay, what is the actual feedback you got from investors? What is, and how come you are sharing all these amazing success stories, but your revenue and funding level is still not there? And you keep hearing, oh, get bigger, get more money, and then come back to us. Now, it's actually very disheartening to constantly hear that, because at the end of the day, you need to have more patients or clients onboarded to get to the set projections for other people to come in to even support you. But keep hearing the same thing is not helpful. It's about what do you have to do to get to that point quickly. And for us, it's actually go back to all the resources that you have right now and look step by step, looking into the foundation, looking into who you have as your major players in a company and the staff and doer level. And sometimes we do have to do an overhaul, not to say to get everyone out of the company, but to get people to prove themselves to stay in the path together. Because we all know with time, with life, very easily people get distracted. So the purpose and goal alignment isn't really there. And they were only with you on the short period of journey. And you have to have the contingency to get the right people there to support you, which means don't be scattered in all your effort. Have only few core people in place that can strategize for you, course correct, or do things for you, and then create a system that support you. Limit your resources. Don't spread and thin. That's the point. And make sure you're actually prioritizing on the right thing. So when earlier we mentioned what's your key priority, right? Key things that move the needle. Do you know that from both the quarterly to the monthly to weekly to the daily? And how often are you reviewing them? Now let's better understand the clear path principle, because at the end of the day, just like how I discovered in the ATV ride in Bali, success often come not from having multiple choices. And the more choice you have fatigue, right? Decision fatigue, but from identifying the following ones to create that clear path forward. So listen up, write these down. Number one, identify your core value proposition. How are you positioning yourself out there? What's the message that you have to say and what your entire company have to say? What are the supporting documents, one sheet, deck, whatever else, videos to quickly use them? And doesn't seem like you constantly have to recreate them, because if the message is not clear and people not hearing it over and over again, you can confuse your audience and you keep champions. Number two, understanding your ideal customer's profile. Get into the psychological, demographic, you know those things. You probably did some resources and researches, and don't misguide yourself thinking, oh, my competitors don't do that. They don't even know what they're up to. And when we do researches on behalf of some of the clients, you'll be surprised how much things we already can dig up. So do your homework and figure out what really truly hold them back and keep them up at night. What their true desire of short-term, long-terms are. How are you relating to them when you're in the big conference? Why would they want to come to talk to you and not just someone else in the next booth? So what does that mean to you to be able to get to a 10x instead of just working harder, the double your effort, the old thinking, the old way that's actually never going to get you anywhere? Well, initially it might feel good that you're working more and things seem to be moving, but you're still just you. And you still are just struggling with a couple of your co-founders, and it seems like your advisors were supposed to take on the entire marketing, but you still have to chase after them, asking what's going on. And they're coming back to you, it's like, where is our financials? And even they put you on these bigger stages. Do you speak so clearly that people are rushing after to talk to you and not only cheer you on, but wanted to help you and wanted to buy from you? If it's not the case, then the effort you're doing is not excellent. It's not working. So just because we do something, have movements, doesn't mean movements is results. So one thing we always talk about is a focus funnel. Number one is how you can eliminate things that are not serving you based on your top 3 major priorities. Number 2, how you can create the same task with an automated way. With all the AI systems, process out there, how can you help to not get lost with these connections, capture the right conversation, and searching for the right people to talk to? Number 3, if you cannot eliminate it, you cannot delegate it, you cannot create automation for it, everything is coming back to you. You don't have the right people, you haven't set up the right resources, or you already delegate as much as possible to your team and they're at their wits' end as well. Then you have to decide what are the activities that you can push back, can wait, versus things that you have to black out on your calendar right now within the next 24 to 48 hours to get them done, because those activities will be your multipliers. Do you know what are those things? So use the focus funnel. Number 1 is delete. Number 2 is delegate. Number 3 is automate. And number 4 is delay things you just don't want to. It's really not result driven. And number 5 is dedicate. So it means dedicate time and now to do. At the end of the day, we're talking about quantity over quality. And that's how you can 10 times the right things that are not costing you to only sleep 3 to 4 hours at night and still have to worry about paying for your family, kids' school, and your own business. And you're working so hard to run your primary business and the new innovation you're having in your hand and still feeling like drowning every day. That's not scalable. So let's find your path forward. You probably have a decent amount of teams, you have advisors helping you, and you're still doing a lot. You're ready for the next round of hiring, but don't even have time to write out that person's job roles, or haven't even have time to even document everything that you've been doing because you spend so much time just doing that thing. So let us support you on that. We are launching our HealthTech Showdown monthly game show, which is Shark Tank meets The Apprentice. Go to healthtechshowdown.com to register. For all the general admissions, cheaper than a coffee break. You can get to have time to interact with our investors and our expert panels who's been in business on average more than 20 years of healthcare and business development experience. Those people who have managed more than 100 million assets and those who has successfully exited many companies. So where are you standing in what you need? Or perhaps you need to have even more hands-on work from us. And then we invite you to be a VIP contestant where we actually put you in the boot camp, sharing with you the revenue catalyst framework, whether you're pitching investors, getting the next deal closed, or getting a strategic partner to actually support you to share your mission. What do you have to say within 2 to get the deal closed? And learning from some of the best that are true experts in sales and marketing. At the end of the day, there's a lot to do. But it's not about just doing it all. It's about doing the right thing that truly can support you. So go head over, register, and we will hope to see you there. The event is only capped at 100 people live, so we can actually interact with the audience. And you get to vote who is the winner for that episode, and they get major media press and interviews for winning. Now, we also wanted to hear from you. If you have an amazing story to share, you are an expert in the field, then apply to be a speaker on our podcast. Go to theprovidersedge.com. No matter what is the true insight all of us can capture in this moment, we would appreciate you post it on LinkedIn, tag me, Sabrina Runbeck. If you haven't subscribed to our channel, make sure you do so right now before you hop off. Now, we have many additional resources that are provided for you. Now, send me a personal message so I know where you're at, and whether it's a meaningful introduction that can help you to move forward, or a resource that we have already developed that can help you get to the next level. At the end of the day, we are all about creating effective, sustainable business from day one without you burning yourself or your team out, and continue to be in revenue positive, but not constantly hunger for money and chasing investors when you are having a short runway.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.